Welcome back to Terms of Service. These days, it's possible to track nearly every aspect of your health. There are wearable devices to track your sleep, your exercise, your heart rate, and even apps where you can photograph your meals to track your nutritional intake. I've been thinking a lot lately about how much of that tracking is actually helping to improve our health. So I'm grateful to have Dr. Leana Wen here today to chat about it. Dr. Wen is an emergency physician and former Baltimore health commissioner, as well as a writer and CNN's health and wellness expert. Hi, Dr. Wen.
Hi, great to join you, Claire.
Thanks for being here. So to start, do you use any of these health tracking technologies?
I do. And I knew that we were going to have this conversation, but I actually just always have my watch on. So I am training for a triathlon. And nice. I find that the fitness watch really helps with training purposes. I don't have a lot of time. I've got young kids and full-time work. And so I try to make the most use of my training. And so the wearable helps me with that.
So I mentioned a few examples in the intro, but are there other examples of health tracking technologies that we're starting to see people really commonly use these days?
Yeah, so I think that fitness is one that we certainly see a lot of people track. They use the watch to track the length and intensity of the exercises. Perhaps they might use AI algorithms that help them to plan the next day's sessions based on how they've done before, and all that data are captured by the wearable. Sleep is also very common too. It's also factored into fitness and preparedness. And for other people who are not necessarily athletes, it also helps them to understand sleep patterns and may be used for those purposes as well. Then you have people who are entering information in, but that's still part of tracking. For example, menstrual, fertility tracking. People use wearables for individuals who are tracking closely their food and nutrition. And then I would say too that there's a final category which is really emerging. And that's if they have specific medical purposes and they are working on tracking that with their in consultation with their healthcare provider. So for example, if they have a heart arrhythmia, an abnormal heart rhythm, and they're using a wearable to determine when they go into the abnormal heart rhythm, maybe they'll then take a pill to stop that abnormal heart rhythm. That is a possibility. It's certainly an emerging field, but I'd say that that's a lot more nascent than the more general fitness and wellness tracking.
Yeah, that's really interesting. I feel like I think of these as sort of consumer technologies, but that's interesting that we're starting to see people actually use these in consultation with their doctors. Why is it that you think we've seen such an explosion in this health tracking technology?
I think there are two main elements. First is that there is a growing interest in wellness and prevention. People are really trying to get a hold of what's good for them. They want to personalize their medical care. They want to focus on wellness and preventing diseases. And they also see that there are a lot more data that's available, and they want to use that data and incorporate that into their decision making. So in general, I think that this is a really good thing. By the way, I have no vested interest in any of these health tracking technologies that I'm aware of. I am a fan of them because I think it does allow people to take charge of their health. And that is one big trend that we're seeing. The other major reason here is that the wearables have just gotten better. I mean, my Garmin that I wear all the time, I really never even notice that it's there. The only time that I really take it off is maybe when I'm showering and when I'm playing piano. I feel like it's getting in the way. But otherwise, I wear it to sleep, I wear it to exercise, I wear it to swim, and so forth. And so I think there are lots of other wearables that look nice. They match different outfits. They are rings. They're just things that people want to wear. And I think the convenience factor is a part of it. And of course, we cannot discount. So I don't use it for this purpose, but there are people who like their Apple Watches or their devices that also allow them to receive messages and calls and calendar things. And so I think the always on thing may not necessarily be great for mental health in some ways, but it's important for some people.
When it comes to wearables like the Apple Watch or the Oura Ring, you mentioned your Garmin, how do they actually work to track these health metrics?
It depends on the metric. And so there are some things that we enter ourselves. So, for example, people may enter when their menstrual period is, they may enter the food that they had. And there are often entries for how you're feeling. So you can be more aware of your own sensation along the way. So some of that is just self-entry. For the purposes of sleep, the trackers use something called the accelerometer, which are small motion detectors. And they're tracking how much movement do you make while you're asleep. And then there's an algorithm that computes the estimated time that you're spending in different stages of sleep, and then how that then correlates with the total quality of sleep. Other things are fairly straightforward. Pulse, for example, you use electrical detection to track the heart rate. And so all of these are standard health metrics that have existed.
What about other things like exercise? And some of these things I know they'll measure like readiness or sort of overall wellness score.
Yeah, so a lot of those scores are determined by other algorithms. So, for example, they might look at training readiness for various exercise, and the types of things they'll input include how well did you sleep, what they call your stress level, but essentially they're measuring things like heart rate and respiration. And in a sense, this is not so different if you were tracking all this information yourself. As in, imagine if you entered into an Excel spreadsheet all the individual data of your heart rate over the course of many hours and your sleep stages, and there were an algorithm that you could input these into. That's what's happening behind the scenes for how they derive this information.
Do we have any sense of how accurate these measurements are?
It's a great question, and I would say it depends on what we're tracking. For something like heart rate, there are a lot of data about accuracy. So, for example, we know that some trackers are more accurate than others. Like a chest strap is going to be more accurate than a watch that you wear. Also, people who have a lot of hair, for example, they might have more difficulty with that type of tracking. Although the heart rate tracking and all these methods are certainly improving as technology improves as well. I'd say sleep trackers, again, it is a guesstimate. There is some variability between different trackers, although the studies show that they're generally pretty accurate, although there are limitations. So, for example, if someone has obesity, if they have severe sleep apnea or other significant underlying problems, it may interfere with the accuracy. And so again, for sleep purposes, it's generally not used as a medical diagnostic purpose. If you want to find out if you have sleep apnea, for example, you're not going to use your Fitbit or your Apple Watch. You're going to be seeking a specific diagnostic test. And I'd say that in general, the accuracy will depend on what it is that we're using the tracker for. And so to best understand the effectiveness or accuracy, it also helps to track how you're feeling and not solely rely on the data that you're seeing. Because if you see a big discrepancy, probably how you're feeling is going to be a better measure than whatever numbers were just captured.
Yeah, it's such a good point. I feel like I've seen people on the internet do their own sort of individual tests of like, how many steps did this tracker say I did versus this other tracker? Are there ways to sort of evaluate these companies' claims? I think that piece about just sort of pay attention to how you actually feel is a good one. Are there other ways that people can think about doing that?
I think that people need to start with understanding why they're wearing a tracker. What is it that they're trying to accomplish? I think it's wonderful, by the way, if somebody says, I want to get more fit, I want to get to 10,000 steps a day. I think that's really wonderful. People want to do that, and they're using the tracker for that purpose. But then maybe also take a look at what it is that you should not be using it for. As in, I think that there are certain claims that are made for specific medical purposes. If you're using it for a specific medical purpose, make sure that that indication is FDA approved. And then ask yourself, do you really need it for that purpose? And if you do, maybe it's something that you should talk to your doctor. So for example, there are some medical devices that are approved for atrial fibrillation detection of that irregular heart rhythm. But if you are really concerned that you have atrial fibrillation, why, right? Is it because someone told you that you have it at some point? Are you feeling that your heart rate is jumping all over the place? If that's the case, maybe you need something that's an actual diagnostic tool and your doctor should know about it. And at the same time, not everyone needs to detect atrial fibrillation. For most people, it's going to be a false positive. And so I think being careful about what you're trying to do is just as important as looking at what kind of information you're gleaning from the tracker.
Does health tracking generally lead to people making healthier decisions, sleeping more, exercising more, that sort of thing?
Look, I think that there are some data that are pointing in that direction. For example, there are some data looking at step counts, and people being aware of their step counts could make them do more. As in, you're saying, okay, my goal is 10,000. I'm at 8,000. Let me just get one more walk around the block, and let me see if I can get to 10,000 by the end of the day. I think that, in fact, just tracking, regardless of the wearable, can help people make healthier decisions. For example, individuals who are trying to reduce their alcohol intake, there are trackers available where they can write down how much are they drinking. And some people will say, well, I was not aware that I was drinking this much. I need to cut down. And also tracking in correlation with the feedback is also useful. Again, using the drinking example, some people have said, well, I'm trying dry January or dryish January. I'm reducing my alcohol intake. And now, look, I'm able to sleep better. And look at my sleep stages, right? There, and look, I'm also losing weight and I feel more energetic in the morning. So I think that feedback loop combined with tracking can help people make healthier decisions.
What about in emergency situations? Like you mentioned the atrial fibrillation example. Are we seeing these devices actually save lives in the way that, I know we've heard some tech companies kind of advertise that as a possibility?
I'm sure that there are one-off cases where this is the case, right? That there is somebody who was not aware that they had an irregular heart rhythm. This is now flagged. They then sought medical care. I think that that's certainly a very good thing for that individual. Of course, I'm also concerned about overdiagnosis. I remember being at this healthcare conference where a physician stood up in front of everyone and talked about his experience wearing this watch. And he was wearing some wearable that found that he had an irregular heart rhythm. And he said, after that, he got a whole bunch of tests done. He got some exercise stress tests. He looked at his cardiac function. And the great news after 6 months of testing is that he is fine. He is healthy. And the entire audience got up and clapped. And I thought, wait, the underlying lesson is that he was fine to begin with. And maybe this just added concern and a lot of cost and overdiagnosis. And so I think that there will be a point where these devices can be used more in medical settings. And there are some very interesting use cases where that could be the case. For example, looking at wearables in detecting falls and alerting people of falls in elderly relatives. That could be very interesting. Or using tracking as part of remote patient monitoring, so that could spare the individual a trip to their doctor or a trip to their emergency department. I think that there could be some of these areas that would be really helpful for saving lives, but I think we are a little bit off from prime time for those uses at the moment.
Yeah. Is there a line that can be crossed where there is too much tracking? And how do we kind of know where that line is?
Well, I think that for individuals, if you find that you are obsessing over data and that you're prioritizing the data that's showing up as opposed to how you're feeling, that's certainly a sign that perhaps you may want to dial back a little bit. I know that for some athletes, for example, they have said that it's helped them to not look at data all the time and to have some holidays away from having all of the inputs of data and just really focus on how they're feeling and their perceived exertion and not just what it's showing on the screen. And so I think that that's really the question to ask yourself is this causing you more stress, or is this actually helping you to have less stress because you have more control over your body?
Do you think that the emergence of this kind of consumer health monitoring is going to fundamentally change how we think about health and wellness?
For some people, it already has. It's given people more control. It's helped them to take a more active role in prevention and in their medical care. I think that the next step needs to be to integrate these wearables and the data from these wearables into medical care. There are some very specific medical practices that have begun doing this. And again, for very specific indications like heart rhythm abnormalities. But I think given the ubiquity of these wearables, primary care physicians, who I know have many things already on their plate. And so it's very difficult to integrate one more thing into their workflow. But ideally, this is something that could be incorporated into medical care. And for that to happen, we do need insurance reimbursement for the time it would take for the healthcare provider to consult with the patient. And then I would add one more factor here, which is, as with any new technology, we always want to make sure that it doesn't cause worsening of existing healthcare disparities, because it would be very unfortunate if it's only the wealthy and the people who have access to many health services who are able to use these wearables, and it just widens that gulf, as opposed to it could also help to bridge some of those disparities when it comes to access.
Yeah, it's such a good point, because we're still at a place where most of these health tracking wearables, at least, are fairly expensive. You know, it's a $300 ring or a watch, something like that. Is there also a potential for this technology to be misused, or for all of the health data that is collected to fall into the wrong hands?
That's always something that you have to worry about. And the issue is, it's not enough if the company is assuring you that your data is currently safe. Because what if that company is acquired by another? What if there is a cybersecurity issue? And so I think our data are out there. If you're using tracking apps in addition to your wearable, you're also giving your data to that particular app. And I think data security is certainly something that I worry about, although I'm not sure that I have a good answer for it. I would really just say, when it comes to wearables, to be very clear about what your purpose is, that it doesn't replace, but rather augment how you're feeling. And you can talk to your doctor if you are thinking that it could help you with monitoring a specific medical condition, even if it's something as straightforward as your migraines. If there's something you could enter part of your tracking and integrate how you're feeling on a daily basis with your wearable, that could be a good thing as well. And overall, I think that this trend for better wellness prevention is a good thing. But of course, as with any technology, we have to be aware of the potential pitfalls and be true to ourselves about why we're doing this.
You touched on this a little bit, but sort of on the flip side, are there red flags that people should be on the lookout for that might suggest they're doing too much tracking or going overboard with it?
Ask yourself, is the tracker helping you or hurting you? As in, it may sound very straightforward, but are you getting increased stress because of all the data that you're having to process? Or is it actually helping you feel like you have more control over your life?
Well, Dr. Leana Wen, thank you so much for doing this.
Thank you very much. Great to join you.